Are you diabetic? Do you know about diabetic retinopathy, a disease of the retina that is especially pronounced in people who have diabetes? If you don't know about this disease, do know this. You should be getting checked for it regularly if you want to protect your vision. I'm Dr. Jamal. Let's dive in and understand what diabetic retinopathy is and why it's so important for you to get checked for it regularly. Diabetic retinopathy affects the retina of the eye. Take a look at this picture. This is a normal fundoscopic exam. The ophthalmologist usually takes a look at this portion of the eye. And if you take a look at these things right here, these are blood vessels. They're normal, they're an appropriate number, but in diabetic retinopathy, the retina gets affected, it gets damaged. So let's talk about the retina so we better understand it. The retina is this portion of the eye. It's in the back of the eye and it contains photoreceptor cells. These cells take the light that we see from objects, transforms that light into an electrical signal that travels to your brain by the optic nerve. And your brain interprets that signal into an image. So without those photoreceptor cells, you would be blind. You'd see things, your eyes would see things and pick up on things, but the image that gets back to the brain is distorted and not really there. So you can imagine what would happen if you damage this portion of the eye. Well, that's where diabetic retinopathy comes in. Over time, high blood sugars can leak and damage the blood vessels in those cells. There's leakage, there's a lack of appropriate oxygen and blood flow. And what the eye tries to do is tries to create other blood vessels and pathways to those cells to enable them to continue to get their oxygen. But when that becomes damaged, then the photoreceptor cells can no longer work. There are two types of retinopathy. There is the non-proliferative retinopathy, which leads to a lot of leakage and damage. And then there's the proliferative retinopathy. Take a look at this picture. This is a normal eye exam. The ophthalmologist will use a fundoscope and other tools at their disposal to take a look at the eye. And if you take a look, here is a disc with normal blood vessels. They are normal in caliber, in shape, and in number. But in this picture, look at it. For lack of a better word, it's a mess. And if you take a look, you'll see all these vessels. There's so many of them. There's a whole lot more than is necessary. This happened because in this particular individual, their high blood sugars damaged and caused a proliferative retinopathy. The retina tries to grow those new blood vessels in an effort to continue to provide blood and necessary nutrients with oxygen to those cells. Now, a common complication that can happen at any stage is called macular edema. And this basically leads to a part of the retina that becomes filled with fluid. That part of the retina is responsible for sharp vision. And so over time, the vision can become blurry. And in everyday terms, the patient is struggling to read, can no longer recognize like sharp outlines. It can affect their driving, and recognizing faces can also be very difficult. So what can you do to prevent this from happening? You're probably thinking that, okay, if you start noticing changes in your symptoms, you'll go to a ophthalmologist, get your eyes checked, and you're good. That's not how that works. See, here's the part that gets me. This change and damage that happens at that level progresses at a snail's pace over years. And the damage starts right away, but it's tiny. And over time, that damage accumulates to the point where when you begin to notice it, a lot of the damage has already been done. So by going to an ophthalmologist at that time, you may not be able to reverse a lot of the damage. So it's very important that you get on a system where you are being checked regularly, kind of like oil changes for a car. So what you do is, at the time of diagnosis of type 2 diabetes, you start going to an ophthalmologist. An ophthalmologist can do this exam in 15 to 20 minutes. They can find any damage and offer treatments at an earlier point of damage. And normally this is done routinely. How often should you get checked for diabetic retinopathy? If you have type 2 diabetes, you should have been checked near the time of diagnosis in every 1 to 2 years. If you have type 1 diabetes, you usually get diagnosed, and then within 5 years, you have to have your first retinopathy exam. But in addition to the regular maintenance, it's very important to understand the root cause of how this damage even occurred, and that was from high blood sugars over time. So this is something you can do every day. The damage that's done to those blood vessels is not just in the eyes. It's actually in the kidneys, in the nerves of your feet. Those are the 3 main places that we as physicians try to protect from further and severe damage. But there are probably a whole host of other places in the human body where damage is ongoing. We already know that people who have diabetes have an increased risk of developing blockages in their heart. So blockages in the heart mean blockages in other places of the body. Diabetes has to be controlled. Those sugars have to be tight. So to recap, strict diabetic control will protect you, your retina, the most. But you still need to get your routine eye exams to detect the damage that's already there or to detect it before it becomes severe. If you like this material, subscribe. I'm Dr. Jamal. I'm here to make medicine make sense. Until next time.